Many times parents come to me and ask that my baby is passing motion after every feeding or taking milk. Why this happens? And basically they are worried that the child might have loose motions or diarrhea or some intestinal disease. So I want to reassure all the parents that this is a very common thing in young children, especially children who are less than 1 year of age, and this is not a disease. What happens is the children, when they are taking milk or any kind of food, their stomach distends and the last part of the colon as a reflex contracts. So whatever the stored stool matter is there over there, that comes out and that causes motion. So basically this is a reflex mechanism. You can understand it in this way, that our intestine is 20 feet long, so it can store lot of food matter, but babies' intestines are small, so when they consume new food or milk, they want to make space in their tummy. So whatever leftover stool matter is stored in the anal or rectal area, that comes out. So that is why they pass motion every time they are taking feed, and this is a very normal thing, and this is not a sign of a disease. As the children grow, as they become older and they are taking more of a solid food and liquid feed quantity comes down, they tend to make more solid stools, and the frequency of motion after every feed actually comes down. So frequency of motion comes down and they don't pass motion after every feed. So this is a very normal thing. As long as your child is having no blood in stool, it is not totally watery, baby is gaining weight, baby is active, there is no loss of weight, then this is a normal thing and you should not worry about it. Now, when to consult doctor for these frequent motions in babies? If it is totally watery, if your child is losing weight over a period of time, if you notice that in stool there is any kind of blood, or the child is not active or lethargic, or child complains of pain while passing motion, these are the situations you should actually consult a doctor and see whether the child has any illness or a disease. So that is the situation. Otherwise, generally gastrocolic reflex is quite common in children less than 1 year, and it's a normal thing, especially in the children who are less than 6 months of age, who are on totally milk based feeding. This is a very common thing seen. So I hope you have got the answer about why baby is passing motion every time after taking milk, and if you have further queries on the same topic, you can ask in the comment section. Thank you.
Please subscribe to watch all our childcare videos and press the bell icon for latest update.